Okay, let's start. So hello everybody and welcome to Doctors for the Environment Australia's webinar, Mental Health in Times of Climate Chaos. My name is Kate Wiley. I'm a GP and I'm the Executive Director of Doctors for the Environment Australia, and it's my great pleasure to welcome you to our Zoom room tonight where we're going to discuss what isn't particularly a pleasurable topic at all. In fact, what is actually a pretty hard topic. And so I want to acknowledge that right from the get-go, that what we're talking about tonight is emotionally tough, and that, for some people in this room, this is going to be, a bit of a heavy going conversation. I'm going to be very happy to stay online afterwards and to talk to anybody that needs to about what we talk about this evening. And in a minute, I'll put the links to Lifeline in the chat. But just want to say that from the get-go, that mental health in times of climate chaos is a serious problem, and lots of us are really feeling it. I also, of course, acknowledge that we are all on stolen land, that First Nations people have never ceded their sovereignty of their land, and respect is owed. I want to offer my respect to First Nations people, past, present, and emerging, and welcome any First Nations people who are joining us here this evening. Of course, it's NAIDOC week, and so it's a time of celebration of our First Nations people and all that they, give and do for our country. I'm on Ghana land, so Namani, which is hello and welcome to a group of people in Ghana. And so again, thank you very much for coming. The third thing I want to acknowledge is that we live in a time of planetary health emergency. So there's 9 planetary health boundaries, and we've breached 6 of them, most notably climate change, biodiversity loss, land use change, our over-reliance, plastic waste, or the novel entities. I'm forgetting a couple: nitrogenous waste, biodiversity loss. Did I say that? Anyway, we have put ourselves in the danger zone due to our human-made actions, most notably our continued pursuit of economic growth, our dependence on fossil fuels, and all the harms that they bring. And, maybe it's time that we reimagine how we live on this planet and start thinking about protecting each other, protecting nature, and coming from a place of heart rather than a place of continued growth and greed. Anyway, on without further ado, I'm very happy to be joined this evening by 3 of my colleagues at DEA who are, experts in mental health, and I'm so pleased that they're all here to share their knowledge and understanding of this topic with us all. I'm going to introduce them in order, and then ask them to speak to the question of why, as mental health professionals, they're involved in work to address the planetary health emergency. So firstly, I'd like to welcome Dr. Anna Seth. Hi, Anna, how are you? Anna is a GP with a special interest in mental health, climate change, and women's health, and is based in Lutruwita in Tassie. And she's a member of DEA and a climate-aware practitioner with Psychology for a Safe Climate. Hi, Anna.
Hi, Kate. It's a pleasure to be here with you all tonight. So in terms of why am I, as a mental health professional, involved in this work, I think there's really two sides of that answer. There's the professional and there's the personal story behind it. I think as a professional, I've always gravitated towards mental health in my work and always been keenly aware of issues of social justice. And in the background, I was, always concerned about environmental issues, but I never really joined those dots, I think. And for me, it was a really pivotal moment back in 2019. We just had some pretty horrific fires where I was working. And I'd seen the impacts of those on my patients. And then DEA had their conference in Hobart that year. And I was listening to, it was Professor Helen Berry was giving a talk where she discussed the case for systems thinking about climate change and mental health. And she showed this slide that just laid out, some of you may have been there, with brutal kind of clarity, the connections between what's happening to the planet and what's happening to our mental health. And it was one of those real penny drop moments that once seen, I sort of couldn't unsee. And so from then, there was a whole series of sort of conversations and becoming more involved and educating myself and connecting to many other amazing people who'd been working in this field for a long time. And, a few years ago, myself and Sibel coming together to start the mental health specific interest group within DEA, and doing other things, because I think, yeah, once you see that connection, you can't unsee it. And our role as advocates is to speak out about things that are wrong when we see them. So I think that's the professional side of it.
Mm-hmm.
The other side of it for me is more personal. And I think, for me, as somebody who's always felt a strong connection to nature, over the last few years, I've gone through a series of really personal losses and bereavements. And nature always held me steady through all of that.
Mm.
And I think for me, the other thing that has happened is a really strong sense of reciprocity. So wanting to return what I feel nature has given to me. And I guess in that, learning about the work of like Joanna Macy, who those of you who are familiar with Joanna and know that she is currently very unwell, um, but other people like her, and kind of coming to understand that ecological sense of self and a sense of reciprocity with the earth. So that's the more personal narrative that kind of that sits alongside that professional interest. Apologies, Kate, if I've gone on too long.
No, that's lovely, Anna. And I think those two things tie together really, those penny drop moments, but the reciprocity and as a healthcare practitioner, our responsibility to, look after our community and their mental health as well. Um, Secondly, I'll introduce Dr. Sibel Day, who is a child and adolescent psychiatrist. Hi, Sibel. She researches mental health, climate change's mental health effects, works at Sydney Children's Hospital Network, serving local and remote patients. In her research at Uni NSW, she's investigating ways to improve mental health in the face of climate change, and leads DEA's mental health interest group, and is dual qualified as a paediatrician. So pretty impressive person, Sibel. Hello, welcome. Same question to you. Why are you involved in this work?
Um, Look, there's been a whole lot of things that have happened that have drawn me to this, but I think similarly to Anna, there was really a pretty pivotal time between 2019 and 2020. For me, as a child and adolescent psychiatrist, I hadn't at that point realised that the increases that we'd been seeing over the previous 10 years in children and teenagers presenting with serious mental distress, with suicidal thoughts and behaviour, were connected in some way to climate change. I saw them as two separate things. But then after I'd seen the disruptions from bushfires to the areas I was working in, and then seen more children presenting, I started to look at the literature, and then I started to look at our data of the children who were presenting in emergency departments. And a few years later, that led to a publication. But back then, I was plotting temperature, so just the average temperature for the day, which you could find freely on the BOM, on the Bureau of Meteorology, against our emergency data of children and young people presenting with suicidal thoughts and behaviour. And before that, I didn't have any real way of explaining why we had seen more and more young people. And looking at that graph, I just could see that, in fact, whenever it was warmer, we had more presentations. And the contrast from when I started back in 2000, 2001, where you might get a half a dozen children and young people in a 24-hour period to a big emergency centre for children and young people, you could get up to 20 or more in 24 hours. And we really couldn't explain that, but we know that one of the things was that it's been getting hotter and more young people are exposed. And then when I looked at the literature, actually had been published elsewhere. So for me, it was that clinically seeing more children, more young people, more severe presentations, and then realising that actually people had been doing these studies, but those two things weren't being put into clinical practice or prevention. And so since then, I've been trying really hard to get people to do something, and I feel like we're starting to make some progress. People are starting to understand that there is a connection and that this is actually an opportunity to do something to protect people's mental health. We do have answers for why things are getting worse, and we can do something about it. So that's why I'm here.
Oh, thank you very much, Sibel. And I didn't know that was how you did, because you do this wonderful research around, well, wonderful is a hard word, but around heat and mental health. And to know that that came from your own observation, I think that's a really fascinating thing to know about. And now I'd like to introduce Rob Ferris, who is hi Rob. Rob's worked for 30 years as a forensic psychiatrist with the UK's NHS and returned to South Australia after retirement, joined DEA, and now leads our SA Healthy Investment Group. Rob lives on the Fleurieu Peninsula and has witnessed firsthand the devastating impacts of the recent algal bloom, or its current algal bloom actually, brought on by a climate-induced marine heat wave, and it's absolutely having pretty devastating effects for us here in South Australia. So Rob, same question for you. You know, as a mental health professional, why are you involved in work to address planetary health?
Okay, thanks, Kate. Good evening, everyone. So, as you said, I'm an Adelaide guy, but I worked in the UK for 30 years as a forensic psychiatrist. I retired. I'm a bit older than most of the other folks here, I would say. I retired a number of years ago, and I came back to live in South Australia 5, 6 years ago. And I guess I would say I was a pretty kind of averagely aware person in relation to climate change, but it was impossible to ignore it as a reasonably curious, well-educated, averagely aware kind of person. So I realize now, I mean, I bought my first hybrid car in the UK in, I think, 2005, 20 years ago. And I'm only seeing, hybrid cars really popular here in the last few years. So I guess it goes back quite a way. But I wouldn't say I was particularly aware of climate change any more than average until after I'd retired and came back here, and I was thinking, what would I like to do? Something useful. And it seemed to me, thinking about it, that really climate change and the environmental crisis was the big news. It was, some people would say, the only game in town, the big thing if one wanted to get involved. And as part of the South Australian psychiatry branch education evenings, I went along, and someone from DEA, an anaesthetist whom we know well, Ingo Weber, came and gave a talk. And on the basis of his talk, I joined DEA. And I guess that was a big moment for me, because it's just gone on from there, joining that community of people, reading stuff, going to conferences, meeting people, discussing with them, and so forth. It's just evolved and evolved for me. And I wouldn't say that initially I made a very strong connection between my mental health background in forensic psychiatry and the DEA work. I mean, I joined the Healthy Investment Special Interest Group, and I convened the South Australian group. It's like about the money. I thought, follow the money, that's important. That's a big deal. But I think the mental health awareness has grown stronger, and in the last few years particularly, and being asked to do presentations and reading stuff, it just seems to be becoming more and more prominent. And then personally for me, and maybe I can say a bit more about this a bit later on, the algal bloom has been a real moment. It's affected my mental health personally, and I've seen it around affecting other people in my community as well. So it's just come to the fore, and the whole thing has just grown steadily over time. I think that's my answer.
Thank you very much, Rob. I'm, very happy to have you here. And I think it's very hard to ignore that algal bloom. It really is, for anybody else who's coming in from South Australia, where it's pretty hard to miss it when you walk down the beach and there's dead marine life everywhere. And, it's this thing that I don't think any of us are immune. None of us can ignore it anymore, I suppose is the point. So, Sibel, first big question to you. Our mental health special interest group has recently updated our mental health report, and I'll put the link to it in the chat in just a sec. And big question for us, for 5 minutes. So I do apologise to you, Savelle, but could you please sort of outline, what are we seeing with mental health impacts? What are the main ways that climate is impacting mental health for us?
Okay, 5 minutes. I've got the timer on. Look, I guess the things that I really wanted to get across, I started with when I was talking about how I've got involved in this. We hear a lot in the media about being distressed and concerned about climate change, and I suspect probably just about everybody here has had at some point, if not now, some level of distress, discomfort, unhappiness about what's going on with climate change. And often that's a healthy response to the unhealthy situation we're in. And while it can be so intense, go on for so long, and you may not have enough support to the point where it triggers some kind of symptoms, for the most part, it's a stressor, and it's a response to an unhealthy situation. But what I've seen, and what we've got in our report, is that not only are people understandably concerned and distressed about climate change, but it's having really major effects on people's mental health already. And we were already seeing that 5 and 6 years ago. And the thing that I guess has got me is that we still have a big gap between the evidence that's already here and the action that we need to take. And I think one of the things that this report does is really sets that out. So those 4 main ways that climate change is known to impact mental health. So there's the direct impacts. They're the ones that, for the most part, we're perhaps more familiar with, like extreme weather events, bushfires, floods, storms, things that cause trauma, that also increase anxiety and depression, and they have flow-on effects for a long period of time. But then we also have the temperature, and that's one that I guess was a real wake-up call for me, that it's actually not just an extreme event in a sense that you can see a fire or a flood, but actually just being too hot is known to increase all mental health emergency presentations and has a number of other serious mental health effects. And then we have drought. So that's the direct ones. Then we have the indirect effects, and they're the flow-on effects that are not about your own awareness, but are about the other flow-on effects. So things like disruptions to schools, work, forced migration, food insecurity. And those are ones where I don't think I was expecting to be so aware that they were happening here. But even in the beginning of this year, the major highway separating far northern Queensland from the rest of Queensland was washed away. And so actually food getting to Cairns was significantly delayed, even in Australia. And then we've got physical illness. So we've got direct, indirect physical illness. We know that climate change is increasing rates of heart attacks and strokes through a number of pathways, including heat, but also actually fossil fuel pollution's increasing that, and increasing asthma. All 3 of those are examples of things where we already know that they increase rates of depression and rates of anxiety. So with all of those, it's not a new risk that needs to be proven or understood. These are things where we already know that exposure to these things increases mental illness and mental ill health, and we know that the population's getting exposed to them more because of climate change. So bringing that all together, I think the thing that I'm really struck by is we have that information. We know that we need to take action to address climate change, to reduce those impacts, and to prepare the mental health system to be able to provide the right care. And what we're seeing already is that the mental health system in the public sector is not able to provide sufficient care with the increases we've already got. So there is urgency to actually get that awareness and get the action happening. And I guess the other thing to say is in the report, there is more. There is also what we can do about it, how to understand it from a systems point of view. So it's not only this hard information, it's also where to from here. But I'll hand back to Kate.
Oh, no, thank you very much, Sabelle. And it is a lot to kind of summarise. But so I'm just going to feed back. So it was the direct impacts, the indirect impacts, the mental health impacts of physical things that climate change is making worse. And then did you just want to talk a little about climate awareness?
Sure, I'm happy to do a bit more on that. So look, while I at the beginning was mentioning that in fact probably everyone here has had some level of awareness about climate change that has had some emotional impact, because it's normal, it's healthy to have a response to something serious that's going on. There are a range of ways that that can manifest or can show up. And I think one of the things is that while the terminology is often things like climate anxiety or climate worry, in fact, people can feel hopeless or angry or sad, a whole range of emotions, essentially any emotion, because you're having an emotional response to something significant that's going on in your world and that matters. The other thing is that some people are more impacted because they've got a particular connection to nature or the land, and that's particularly also relevant for First Nations people and for young people. And just to touch on that, and I've got my scarf on here because it is NAIDOC week, and just to acknowledge that, in fact, both those groups, First Nations people, Aboriginal and Torres Strait Islanders in Australia, and young people and children throughout the world, have been leading the way in many ways on taking action on climate change. So not only are they very much impacted through awareness of that connection with nature in terms of First Nations people and that awareness of how much of their lives are being impacted for children and young people, but they're also actually stepping up in ways that many of the older generations who are in charge, and I don't mean all older people, but people who are in positions of authority, have not been enough yet.
Yeah.
So I think those are some of the layers, and we can.
Yeah. Thank you, Sibel. And it is like, the complexities of that, but also, as you mentioned, the load that we carry. Anybody that does climate work, the load that you carry to do the work is in itself a mental health stress. And that leads me well to talking to you, Anna, like as a practicing, you're a GP and but understand you're working a bit more in hospitals now and undergoing psychiatry training. So well done to you. But what do you see in clinical practice? What's come up
Yeah.
in your working life as a GP?
So I think all of these things which Sibel has mentioned weave their way into general practice work. As many here might know, GPs are actually the most commonly accessed mental health professional in Australia. So we, are very much at the forefront of the rising tide of mental health distress. And I think one of the points that I think is important to make here is that that climate change impacts your mental health, whether you care about climate change or are even aware of climate change, or whether you're not. Even if you don't give a stuff about it, it's actually still going to be impacting the mental health of our communities. So if I reflect on some of the ways in which I've seen those direct impacts play out, primarily through bushfires in rural communities where I've worked, it's the direct impacts are generally either through a trauma or a loss kind of a pathway, and you certainly see those presentations in the aftermath, but it's the indirect impacts. And I think it's commonly understood in the field that disasters have a long tail, and sometimes what you're seeing is really increases in mood disorders, PTSD, substance use and alcohol use years down the track, and that's been shown in studies looking at bushfires in Australia and in numerous other places. Where I've seen that play out in clinical practice, and I think some of the interesting nuances that come out are around who is impacted more by that. So if you're already marginalized or disadvantaged, then all of these things are going to have a more substantial impact. One of the trainings which I have done in recent years, which I would say has been the most informative and useful for me, was training with an organization called Gender and Disaster. And I would highly recommend Gender and Disaster Australia training to anyone who's working in this field, because it really made clear to me how in the aftermath of disaster, gender roles are amplified and entrenched, and that damages everyone, the strong stoic man and the woman who's taking on more caring responsibilities at home. So I think there's all of those direct impacts and those indirect flow ones, which I very much have seen in general practice over the years. As times shifted and I've work now more in a specific mental health role, providing focused psychological strategies. And actually, as Kate has alluded, I'm about to step out of general practice because general practice is just a very hard job, and I think I need to make a change. But I now, I guess I'm in a slightly different position because I'm a climate-aware practitioner with Psychology for a Safe Climate, which has given me the opportunity to do some individual and group work. And I guess people sometimes seek me out to talk more about their climate related emotions. So the spectrum of what I see is perhaps a little different. And I think we also in Tasmania have a large population of climate and environmental scientists, environmental organization workers, and people who are on the front line. So burnout is a really big issue that I see. In dealing with this group of people, they're often very well across, their feelings in response to climate change. Like we say, a lot of us, the term climate anxiety, I think, is overused, but climate rage, climate frustration, grief, a whole range of emotions that people might feel. And they're very strongly connected to their values about how they want to act in response to that. But sometimes what I'm dealing with more is around the aspects of burnout. And, everything is urgent in the climate change space. Everything requires our attention right now. And I think that can be a really tricky thing to work with. And perhaps we can talk about that a bit more later on. I think the other interesting things that I see are around people who are, deeply nature connected. And perhaps the changes that we're seeing in their environment have a profound impact on their sense of self in lots of different ways. So I think it's really a matter of, when you actually put it out there that you're willing to hear these things, it all comes out. People want to be able to talk about those things. Sibel and I wrote an article for Australian Journal of General Practice a couple of years ago, where we talked about an approach to climate distress in general practice. And I think one of the things is just signaling that you're okay to talk about this stuff. And that might be waiting room materials or whatever. But I think some of those aspects about how we respond to climate emotions, we might come to that later. I'll wrap up there. Thanks, Kate.
Oh, no, thank you, Anna. It's a really deep answer. And, I just reflect that, my own work as a general practitioner, screening for climate as because mental health is something that we do a lot of in GP land. And just simply asking the question, are you worried about your planet or are you worried about your climate? And the amount of responses that we get. And I know there's this sort of expectation that, yes, young people are very worried about their future, and of course they are. But my experience has been that, a lot of older people are very worried and that they can see it because they can see the change, and they worry about the future for their family, for their children and grandchildren, and what kind of world they're going to inherit. So I think it's a big problem, and part of our community now. And so Rob, let's talk about what the community that you live in. As we've already mentioned, the algal bloom and the Coorong, which we all saw Storm Boy, right? The Coorong has got this algae in it, and all these. There's a marine disaster at the moment, and so what's it like down there at the moment? How is the community being impacted? How are people feeling, and what's it like?
So hang on, I've got the timer running too, Kate, I think. So just before talking about the community, sort of my place in it a bit, just to get a bit specific and local. So yeah, I live on the Fleurieu, a few kilometers from where the River Murray comes into the sea, and it's a long stretch of open ocean. Adelaide's in a gulf. The beaches there are protected. Anyone who knows Adelaide would know, but down on the Fleurieu, it's the open Southern Ocean. So you look out to the south, and it goes all the way to Antarctica. So it's this vast, vast stretch of ocean. And I realize sort of my connection to nature has strengthened in the last few years since I came back from England. I used to surf when I was young down on this stretch of coast decades and decades ago. And when I came back, I thought I'll take up surfing again and see if my surfing career, such as it was, is actually extinct or has simply been dormant for many years and capable of revival, which turned out to be the case, fortunately, to a limited extent anyway. So I'm a local surfer, and there's a whole community of people along there, people who swim. There's a lot of surfers. I mean, a bit like, when you're a tourist and you go to Venice and you think there's too many tourists, I think, there's too many surfers, but I'm one of them. And so when I'd seen some climate related events, the bushfires in Kangaroo Island. I've got good friends over there. I was aware of the devastating effects when a third of the bushfire, a third of Kangaroo Island was basically burnt. Huge destruction of wildlife, livestock, properties. Unfortunately, only 2 lives were lost. But then it got really personal for me with this algal bloom, because it sort of crept up on people, all these dead animals and reports along the coast, along this huge stretch of coast, and the information about it and the severity of it, the knowledge of that has just kind of grown over time, in the context of a lot of continuing uncertainty about the future. And it really hit home for me when I read this New York Times article about maritime heat waves and was able to put what I was seeing in front of me, this ocean that I realized I love. I love being in it, the dolphins jumping up, occasionally whales now, the beautiful surf. I love the ocean. But seeing this New York Times article, realizing how much of the world is affected by marine heat waves and what they now call supermarine heat waves, and how much that's increased, particularly in the last 10 or 20 years. It's like a penny drops, and you just put the big picture um, together with your local experience. And it's a very powerful experience for me, very distressing, indeed. So the local community, I think early on there was a meeting, a scientist spoke. She gave a lot of information about the bloom, and it was great to see a lot of people there. It was very disturbing. We live in the land of the Nurrunjeri people, along the Fleurieu, and one of the spokespersons there said they had no stories or history of such an event. There have been blooms in the fresh water, in the rivers and waterways and so forth, but an event like this affecting such a huge stretch of ocean was unknown to them, and they've had a close relationship with the ocean here for thousands and thousands of years. So to go back to your question, how is it affecting the community? There was a lot of uncertainty, a lot of grief, people who walked along the beach watching all these dead animals wash up, and gradually becoming aware of the extent of it. You know, it's affecting an area as large as Kangaroo Island, about 4,500 square kilometres along this whole stretch of South Australian coast. And what you see on the shore is just a part of it. Out in the deep, who knows how much destruction and dead marine life is on the bottom of the ocean, you know, decomposing. Nobody knows the full extent. So a lot of grief, and I'd say turning a bit now, a lot of bewilderment and uncertainty, a lot of doubt really, that it would last. And now it's persisting, and it looks like it could carry on through the winter or recur next year. That's sort of making an impact. It's making the headlines and in the papers and so forth. So there are Facebook groups. There was this meeting, and I think it's hard to talk of it as a single community. It's not like a town. It's kind of like it's stretched along a whole stretch of coast. But I think there's a realization of how serious it is. There's a lot of distress. Maybe, people are becoming more active. There are Facebook groups set up, surfers getting together, talking and so forth. That's how I'd answer your question. And my 5 minutes are up.
Oh, you're wonderful, Robert. Thank you. And, and I might just stay with you, but I'm going to ask everybody the same question. And Anna and Sibel, if you want to sort of come off mute and just sort of have a conversation for a few minutes about the cause of all of this. I mean, yes, marine heat waves, and our planet is getting hotter. And we know that the primary cause of climate change is fossil fuels. And yet, Australia is the third largest fossil fuel exporter in the world. Newcastle is the world's biggest coal port, and we are expanding offshore gas. And so I might start with you, Rob, but, what do you think the ongoing expansion of fossil fuels, and seeing our governments do that, How do you think that's impacting on our mental health? Or your own mental health, like personally, it makes me incandescent with rage. But yeah, what do you think, Rob?
Yeah, I mean, it can cause a whole range of emotions, I think, from kind of one of the people in our group, I won't name, said he alternates between feeling despair and wanting to withdraw and feeling really angry and wanting to do stuff and engage and be active. So, yeah, there's a whole range of things. And I think you get some good news. You take some comfort from very small advances. Like this seems so trivial and almost pathetic, but the number of compostable bags, I think they banned plastic bags in South Australia. So all the bags you go to the shops, they're all compostable. And that gives me a kind of little bit of comfort. And, I just like to see a compostable bag and put stuff in it and then put it in the green bin. But you yeah, at times you just get really angry and you feel you want to do stuff. You want to write to politicians, go and talk to them. Some bad news comes in, like the environment minister approves the Scarborough, the Woodside gas and so forth. It's mostly bad news, and I think you to avoid depression and withdrawal, it's good to talk to other people, like-minded people, talk to people about it, and belong to groups. And for me, that's been and remains DEA. That's a very important now, a pretty vital part of my life, um, and very important, I would say, for my mental health. And so I don't have clever suggestions for people who aren't, doctors or medical students and able to join DEA, but there are other community groups. There's all sorts that people can ways of people joining together. I think who was it who said only connect? Was it Chesterton or some English writer? Only connect. That's a good point.
That's a good point. Sibel.
Thank you. I just wanted to, I guess, add on to that, I guess, in terms of resources that are perhaps relevant for anyone, regardless of their sort of work context or professional context. There's a list of resources on the How Climate Change Affects Mental Health in Australia report by DEA. And I've just put in the chat a couple of those resources. And as Rob said, it's the degree to which the community and people over the world are now wanting and needing to do something about climate change. In fact, the majority of humans on the planet want something done about climate change. It's not it's actually most people would like nature to be protected and to have a safe future. So finding people that you can be with is huge. The other thing I just want to comment on about the sort of research around mental health and government action is we know that, in fact, when people see leadership by governments, by people who are in positions of authority, that improves their mental health outcomes. So even if you experience an extreme weather event and you do have something traumatic happen, if that happens in the context where you see leaders doing the best they can to protect you and others and to take action, your mental health outcomes will be better than if you have exactly the same traumatic event in the context of people not showing leadership. So our government just making decisions and leading to do the right thing would improve people's mental health, not only in terms of how concerned they are, but actually in terms of clinical diagnoses after trauma. So it really makes a big difference at multiple levels. And the other thing that I think is really worth being aware of is that the data about linking what are supposedly very small amounts, but in fact are not, of emissions from projects approved in Australia is now being analysed and has been submitted to Nature, and there's links even for one project that the government approves with health outcomes. So that is coming soon.
Yeah, so that evidence is absolutely there. Anna, do you want to add anything to that about, how you think expansion of fossil fuels impacts our mental health?
Yeah, thanks. I think, I'm with you, Kate, and I think many of the people I speak to with you, that the fact that we, continue to pour money into something that actively undermines the very fundamentals that we need to be alive and well, is a major driver of betrayal and moral injury. And we know from those worldwide studies of youth that betrayal and that sense of betrayal and being let down by those who are supposed to protect us is a strong driver of mental distress. I think whilst those emotions are really uncomfortable to feel, I guess my thinking around this in a more, I guess, a psychological approach, that it's uncomfortable to feel those emotions, but they are powerful messengers. If we can allow ourselves to sit with them, we feel angry because of a sense of injustice. How can we allow that anger to be and act on it and drive it into action rather than despair? I'm down here in Tassie where we have Bob Brown, whose catchphrase is "Don't get depressed, get active," which, there's a bit more nuance to this. We do need to, obviously, sometimes what you do need to do is take a break and step back because it can all be a little bit much. I think that's the other point I think to make with this sense of community that we're discussing. And if I can, I guess it's just my personal experience for a while. There is times over the last few years where I've really had to step back. I've just not been able to be engaged for various personal reasons. And I think being part of a community allows you to know that there's a bigger process, there's a collective group of people who are acting on this injustice. You're not on your own. You're not just one person who thinks this and everyone else, is thinking something else. And so you can take a step back and take a step in when you need to. And that's really important part, because this fight is going to be going on for a long time. It's going to go on after all of us are gone. We're in it for the long haul. So we have to make it sustainable. Let our anger and sense of outrage fuel us rather than burn us out.
That's a beautiful sentence, Anna. That's lovely. And I think giving ourselves permission sometimes to put down the load, I think, is really important. That most people on this call would be climate alarmed and active in some way. And it gets you. And sometimes you have to just have a break and, cook tea or go for a walk or do something else just to give yourself time to recoup, knowing that you have to get up and do it again later because the world needs our climate warriors. Let's talk more about treatment then. Let's talk about, we're all, panel, you're all clinicians and, have done a lot of good work in your lives looking after people's health. So, and I'll start with you, Sibel, just from a health systems perspective. What do we do? How do we help our patients? How do we help our communities' mental health in light of climate chaos, this chaotic world that we have?
So yes, there are a huge amount of things happening and there's a huge amount of real things that we need to be concerned about. At the same time, we actually have the information. Like we need to get the politicians, governments, organisations moving, but it's doable. And in terms of what would make a difference for mental health, as well as addressing the drivers, and that absolutely needs to happen. So we need to have accountability so that governments and big organisations are accountable for the flow-on effects of their decisions. And then coming to the actual mental health, as well as protecting people from that, we need to be addressing in planning and policy the things that we know are making it worse. So people having access to things like call shelter, building codes, rental codes, etc., addressing the predictable increases in exposure so that human beings can be as safe as they can in a changing climate, and addressing the workforce issues that we've got in the mental health system. So people are probably aware, but Australia-wide, and it's been highlighted recently in New South Wales and previously in Victoria, we don't have enough mental health workforce compared with what people are needing. And so addressing that in primary care in terms of, I won't get into all the nitty gritty, but there are ways in which it needs to be addressed in general practice, as well as in terms of the public mental health system. And then actually making sure that that is continuing to loop, that information is continuing to loop back so that our mental health, physical health, climate, environments and energy sectors are talking to each other. And that's why we need a systems approach, because if you have the information, the solutions we already have can be put into place.
Yeah, and we do have this sort of siloed thinking, don't we? And it seems like governments are great at siloed thinking, where you've got DQ and there's, and the environment, there's the health minister, you're just across the corridor. You think they might occasionally, have a bit of a chat and see how their worlds collide, but it doesn't seem to quite happen. Yes, please, Sibel.
Sorry, I just want to make one other comment, because both because it's been my experience, but also because I know someone on the call is aware of this. But there are examples where people in places like DQ are really listening and trying to elevate these kind of conversations. In the New South Wales ADAPT conference last year, they actually had a session about climate change and mental health and highlighted how the systems thinking and bringing people out of silos is super important. So I just wanted to flag that there are examples where this is starting to happen, but we absolutely need to accelerate and build on it.
Absolutely, there are great people doing great things, and we have come a long way if we look back to where we were 5 years ago, 10 years ago. And of course, systems problems are hard. That's why they're called wicked problems, right? They're tricky things. As a community worker, and you talk about your work with treating people with climate distress. What's some what are some tips that you have about dealing with climate mental health?
Yeah, absolutely. So I think there's actually quite a lot that we know, as Phil alluded to. The information is there about what helps in the literature, and I think but that continues to evolve. I guess some of the things which I would stress as being most important, we've talked about a lot today, and this is about having a place to actually discuss and share those emotions in community with others who share your concerns. And I think it's important we allow space for that's depathologizing as well. Let's not locate the problem within the individual here. The problem is within the environment that is creating this distress. So I think that's probably, if nothing else, it's about being able to have a place to express and share those emotions, find commonality, find people who think like you do, care about the same things that you do, and to connect to them. I think it's also important for people to be able to shift from a sense of not having any agency to being able to find a sense of agency. We know from the research that one of the most effective strategies is what's called meaning-focused coping. So these are ways that are, I guess, thinking about things in a transcendent way, seeing examples in society where humanity has overcome, perhaps a sense of that common humanity, and being able to build a bridge to a sense of agency. So what people like Joanna Macy call active hope, not just the kind of passive wish that things will get better, but what can I do? But then I think it's very important when we're having those thoughts for ourselves that you can't do everything. You might want to do everything. When I first kind of had my kind of climate awakening, which I think a lot of people here have described in various different, I wanted to do everything. I needed to do everything all the time. And that I rapidly found was unsustainable. And I think we have to kind of cultivate this idea. We want to create a more sustainable world. We have to build that in ourselves as well. There's some really lovely work I've seen done, which is about climate Venn diagrams. Some of you may have seen this, but it's about finding the intersection of, what needs to be done, what are you good at, what do you enjoy, and finding your thing. You don't have to do everything. Again, it's about trust in that broader community that together we can do it. Sometimes I think, even with all of that in mind, we need to take that step back, do that self-care. That might be unplugging from the news, watching a movie. That's fine. We need to allow that. And the other fundamental, which I would put in here, is around fostering that connection to nature. That's why we're all here. That's why we're all doing this. Nature is a great source of solace and support. I think there are many, many lessons and health benefits that we can draw from connecting with nature. That's, sort of even at a physiological level, we know that spending time in green and blue spaces is good for us, right? So I think those are some of the ways that I work with people. There's more that I could say, but perhaps I will leave that for another time. But if we're thinking about psychological models, one which I feel holds the most promise is a model called acceptance and commitment therapy, which some people may be familiar with. So I think that's often a model that I will work with when I'm dealing with people with climate distress, and that's something that people may wish to explore more. Thanks.
Oh, good on you, Anna. Rob, would you like to add anything there about how we protect our mental health from this problem? Or
Well, I think maybe before we turn to the rest of the audience, I agree with everything that Sibel and Anna have said, and you even you're all still practicing clinicians of one sort or another, and I am not any longer. I particularly agree with, kind of taking time off. I mean, I live a privileged life. I'm retired, I've got lots of time. I can go and hang out by the ocean. I can go surfing and read books and whatever, lucky me. And but and I guess if you're if something keep yourself informed, but don't drown in information. I mean, so in relation to the algal bloom, just to give you a particular example, I've learned a lot about algal blooms and about the ocean through necessity, through trying to understand it. And one of the things I learned was about the Great Southern Reef and how little is known or understood about that. And there's a particular request for $40 million for people to research the reef and come to understand it much better than we do now, so that we can contextualize what's happening with the bloom. So I'm going to write to the environment minister, just in support. Please, they want $40 million to explore, to study the Great Southern Reef. Please, it's not much money, grant it. So you just pick some small particular thing that you can do, and do it. And as Anna said, it's easy to be overwhelmed by the vastness. Take comfort in the big things. So looking back, the Inflation Reduction Act, I remember when the Biden administration put that through, my mental health improved in the way that Sibel is saying. If leaders are showing the way, rejoice in those moments when they happen, even if they don't happen nearly often enough. That's what I'd say.
thank you, Rob. And also that thing you touched on, that thing of when we're active, like that we're all one tomato on the vine, right? We can't change everything, but we can change what we can have agency in what we do. And like I can do what I can do, but I can't control what other people do. But when we do things, I think we should acknowledge that we do them. Like say, okay, like everybody here tonight, we came to a webinar to talk about mental health in times of climate chaos. And we did that because we want to create a better world. And so we want our world to be safe. And so we acknowledge, acknowledge that we did it. Like this is a thing that we did. We did a positive action. You're going to write to, Minister Watt and say, hey, $40 million to look into this SA algal bloom isn't really a whole heap of money in your world. Doing that is a good action. And then we acknowledge that we did it. Go, okay, I did my thing. I can hope that other people around me will do their thing too. And, if we all do our things, maybe we'll, create the change that we need. So very interested in questions from the floor. If anybody would like to ask a question, please feel free to come off mute or write it in the chat if you like, and I'll read it out, or have any comments or not. Don't have to. People might not want to, but if you do, please do.
I have lots of questions. Are we putting up hands or just unmuting?
You go for yourself. You go for it, Natalie.
Yeah, given the expertise in the room, I just wanted to ask, I'm moving into a therapeutic space after being kind of more academic democracy practitioner, and also, so I've stepped into kind of vet training and therapy, and hoping to specialise in, and I noticed that somebody else was also seeming to walk a parallel path, eco-grief, anxiety, counselling, particularly focused at on our children. And I'm really interested in just where is there movements within the education sector towards helping our children kind of at scale, because I'm not seeing that much evidence of it in WA, and I'm wondering what the impediments of that are, and also as part of that kind of building resilience for our children in line with helping them to act in a very difficult world. Just, where is the kind of nature as therapy movement I know it's been on the outskirts for quite a long time, or, not so much mainstreamed. And are we, is there signs of us moving into mainstreaming that? I appreciate your expert thoughts on that.
You go for it, Sibel.
Sorry, I'm
You
really
go.
keen to talk about this topic, so hence the hand up. Look, really good questions, Natalie. Absolutely. So in terms of what's happening around addressing distress for school-aged children and in education, there's actually a whole lot of work happening in that space. So one of the people we were talking about just before we started this webinar is Emma Lawrence, who's originally from Adelaide, but is based in the UK. And she and others internationally have been looking at some of the research around what can be done in a school setting that's likely to help both young people, children and young people's mental health, and address what's happening to them in the face of climate change. So both not just get them active in climate change, but actually what we've been talking about here, that need to be able to respond to it in ways that are healthy for them. And there are things happening locally as well. So in terms of the sort of research space, I've been fortunate to be involved in some research with the University of New South Wales recently, where we were looking at what evidence is out there. And there's actually been quite a big pilot done in the US, which we can put the link to the website in the chat on. And in fact, Kelly's put it in the chat. So one of the people on this call has been working really hard in this space. I'm not quite sure how much I'm supposed to say about that, but she's put in the chat so I can say it. So Adapt New South Wales is piloting some resources. The Joyality group has been working hard on them with First Nations people and young people, and they're really exciting. I've seen them, they look awesome. Okay, I'm allowed to say more. So what we know is having time in nature in schools is good for your mental health. So there's academic peer-reviewed evidence that shows that. We also know that from the evidence so far, having psychologically safe, developmentally appropriate climate education in schools is not associated with significant mental health risks. So there's been a bunch of research. We've looked at more than 1,800 articles. So contrary to some of the recent misinformation that's been out there, and we can get into that if there's time later, it's an open letter about that. Actually, when it's done properly, that's not going to make children's mental health worse. So there is stuff happening in this space, and probably I might come to your other question about, because I know you had another question about what should we be doing in response to children who are distressed. Was that the other part of the question?
No, but that is a good question. If you had time to more just around the growing, we have a Nature WA.
Okay, the use of nature-based.
Yeah, like starting to like the remedy is it's almost using what is the source of distress as the remedy. Yeah.
So there's emerging evidence around that, and I guess from my point of view, I think I personally, and I'm a sort of research hat as well as professional hat, I suspect the reason why the amount of research that's available to support nature-based therapies and mental health is less than, say, for pharmaceuticals, and in fact for some structured psychological therapies, is because there has not been a financial benefit to people in showing that spending time in nature is good for your mental health. What we do know, though, is that children who spend time in nature when they're growing up have long-term benefits in terms of their mental health. We know that classrooms that include significant bits of time in nature have good outcomes. There is some evidence for milder depression, but that's still a work in progress. So it's not really at the stage where we could be saying someone who has a diagnosable depressive disorder could have nature-based therapy as the only treatment in the absence of psychological therapy or some other evidence-based therapy. But it is at the point where we need to be really aware of it, and we know there's lots of co-benefits to people's well-being, blood pressure, etc., for spending time in nature. So it's I think it's coming. it's certainly, there's some evidence that it's beneficial. In terms of sort of specific mental health treatment, we're probably not quite there yet, but it's, yeah. So that's I guess, a really important watch this space, plus the awareness that there's lots of co-benefits. And certainly personally, I find spending time in nature enormously beneficial, and I think lots of other people do, and it's worth, if people notice that, it's absolutely fine to be supporting them to do that.
Absolutely.
Yeah.
Absolutely. Do we have any other questions? Anybody else would like to speak?
I have a question, if that's okay.
Go for your life, Anna.
Hi, I'm Anna. I'm a psychiatry trainee doing advanced training in child and adolescent psychiatry, and I'm particularly interested in how young people might present with mental health problems related to climate anxiety or whatever feelings, eco-distress. But a question for you, Sibel. I guess I'm just interested. I work in sort of like a tertiary KIMS service, and we are often dealing with really, really acute stuff, really horrible trauma and things that are just, I guess the acute problems rather than the grumbling. Oh, and by the way, there's this huge existential threat that is the backdrop of all of my woes. I guess my question is, I'm just interested to know, in your clinical experience, how do people present? And I know Anna's spoken a little bit about that. I was particularly interested in young people and how they come to you with their distress when it's related to the climate, what that looks like.
And really good questions. I think probably part of the answer to this needs to be to place what's happening with presentations in Australia in the kind of socio-political context that we're in. So given the long period we've had of this very divisive and very lots of misinformation and sort of it not being psychologically safe for people to talk about their concerns in lots of different situations. I think the fact that a lot of my general practitioner colleagues have seen more children and young people expressing concern about this, and that studies in the UK have shown higher rates for people presenting to child psychiatrists, is probably reflective that children and young people have not felt safe to say that they're concerned about this. So if a child or a young person goes into a space where there are sort of symbols that, there's things like, say, posters or information that conveys this is a practitioner who's comfortable to talk about X, Y, or Z common concern about from children and young people, they're likely to be able to talk about it. But because we have had, and that unfortunately does include medical professionals, people sort of shutting down, invalidating, and generally doing things that are unhelpful, both publicly and in clinical settings. I think that is probably why children are more likely to go to their teacher, and they may go to their GP. And that's changing in the sense that when there are more practitioners who've got something in their office that conveys safety, then people are much more likely to talk about it. So I think we know from the community surveys that children and young people are really concerned about climate change. So they might also be depressed, anxious, developing psychosis, have trauma that's not climate related, but chances are they also have some concerns about climate change. But unless we have a way of making it clear that it is that it's safe to talk about, it's a bit like whether they're safe at home from a trauma point of view or what their gender identity is. They're not going to feel that they can talk about it unless there's some sort of message about that. And even our college, the Psychiatry College, still has a way to go on that, in that, yes, the progress has been made, but it wasn't long ago when if you went up to senior colleagues of ours and said, climate change is important for child and adolescent mental health, they would have looked at you like you were a bit funny, and really maybe they might humour you if they knew you, but otherwise they probably wouldn't.
Yeah, I just want to interject quickly, and then I might just see if Anna wants to add something to that before I ask a question that's in the chat. I think one of the interesting things to just comment on is that in a general practice room with children, you will have the parents present, and that sometimes children might not want to, if the parent's unaware, or they might be protecting their parents from the knowledge as well, so that's just part of the barrier as well. Whereas if it's already being a conversation in the schoolroom that's opened up, and in that group that's a safe place to talk about it, I just wonder if there's like a barrier there, because we still have a lot of people who are not as able to talk about it. That's not a across the board thing, but I just think that's an interesting thing to consider. Anna, what would you like? Would you want to comment?
Just briefly, but just I think echoing everything that Sibel's saying, but I think if they know it's a safe place to talk about it, they want to talk about it, actually, in my experience. I, over a number of years, used to go in and do sessions for Tasmanian Youth Climate Leaders, which sort of brought together children in high schools, and I'd do a session about well-being. And I would have kids come in to my general practice because they knew I was a safe person to talk about it and raise it. And look, often I would find it would be perhaps in the context of other, more generalized anxiety, but it's there in the milieu. And what I would find, and this is with, I guess, younger people and with adults, we may actually not spend a lot of time ongoing discussing that specifically, but it's almost like they know and I know we share this understanding that there's this bigger thing. And so we can work on the other stuff, but we have this mutual understanding that there's this other thing sitting behind it. The other specific thing I would know I've had come up a few times is around children who are with restricted eating, vegan diets, etc. I think exploring what's behind that. Because because so many children they lack agency to make choices about what the household is purchasing, doing, whereas food is, as we all know, something that can be controlled. And so that's an interesting little space that I've seen come up a couple of times and warrants exploration, I think, when there's a very restrictive vegan diets.
That's an interesting thing. Thank you, Anna. I'm quite aware of time. We have gone over time, but of course I feel like people are happy to be here, but we'll just ask one more question that's in the chat, and then I'll get quick closing statements from our three panelists, and then we'll all go and acknowledge our achievement for turning up at a climate mental health discussion. So, and it's from Zoom user. So you are an anonymous Zoom user. We do not know who you are, but it's referring to the climate case that'll be decided on next Tuesday at 2:30 in Cairns. And I've put a link to the case in the chat if people want to learn about it. But if the court decides to support the actions by Torres Straits Islanders Uncle Paul Pabe and Auntie McRose, who I've heard speak, could impact on Australia's government climate acceleration. So going back to what we were talking before about climate action from our governments, what kind of impact do we think this might have on the psychological damage caused by government inaction and misinformation? I've not paraphrased that as well as perhaps I could have, but would anybody like to comment on that? Yes, no.
I guess I'd just like to comment that seeing a legal process that holds government to account and where there is a sense that democracy is functioning, that the legal process is actually working, is likely to improve people's mental health because it addresses that sense of betrayal. And in fact, it might lead to the government actually doing more things which would probably benefit other people's mental health around this as well. So I would think it is very reasonable to expect that there would be some benefits to people's mental health.
I suppose it depends which way it goes.
Sorry, assuming that they are found to have a responsibility.
Yeah, well, I suppose this is it. We'll know what the decision is next Tuesday. It could go either way. But yeah, I agree, that sort of sense of people using the courts to have climate action. Surely that's a good thing. DEA is doing it. We've got a case next Monday. Rob or Anna, would either of you like to comment on that, or perhaps a closing statement as to just sort of sum up how you feel about mental health in times of climate chaos? Rob?
Well, yeah, I guess I'm conscious. I'm over 70. I'm constantly into generational aspects of this, intergenerational justice and so forth. What I would say is, yeah, try and keep a balance. It's definitely a marathon. It's not a sprint. Everyone's in this for the long haul. So you've got to live a kind of balanced life and not compartmentalize your actions in relation to this. But yeah, keep informed. But don't bury yourself in endless information, gloomy information about the algal bloom or climate change or anything. But keep abreast of it. Talk to your friends and family. Find like-minded people, whether that's in my case in DEA, other people in communities. Find them, seek them out, and maybe join with them to do what you can, and keep doing those small things in your own life, like being glad about compostable bags, or the fact you can afford an EV, or whatever. And yeah, just try and keep sane. And if you love the ocean, well, buy a surfboard, whatever. Go out into nature. Get some time in nature if you can. That's very important, I think. Yeah. That's it from me.
Thank you very much,
Thanks.
Rob. Thanks so much for coming and talking to us. Anna, some closing statements from you, please.
Look, I just was in my mind. I talked about Joanna Macy earlier today, and she's close to death at the moment. But there's a quote of hers that I just wanted to share as my closing statement, because she says it much better than I would. But I think it encapsulates some of what we've been trying to get at today, which is you don't need to do everything. Do what calls your heart. Effective action comes from love. It is unstoppable and it is enough. So I think that pretty much wraps up what I would like to say.
Thank you, Anna. It's beautiful. Sybil, anything to add?
It's a pretty hard act to follow. Look, really grateful to being here with everybody tonight. And I guess I would just flag that I think that is actually the superpower that humanity has, is that there's so many of us that want things to be better, and that are willing to collaborate with other people, are willing to stand up and do things. And that's actually really powerful. And I also agree, we all need to look after ourselves and have breaks as well. But I think just to not forget that actually together we can. There we go. That's a line from me. Well, it's not my line. I'm repeating the Canna line. Together we can.
Together we can. I think that's beautiful. Well, let's leave it there. I'll have my last little line too, which is, the world is run by those that turn up, so turn up. And our planet is worth saving, and so are we. And you don't have to do everything, but do what you can. So thank you, everybody, so much for choosing to spend your Wednesday evening with us talking about mental health in times of climate chaos. Doctors for the Environment, we believe that you need a healthy planet to have healthy people. And basically all our work comes back to that. So yeah, good on you. Thank you very much, and see you next time.
Thank you.
Thanks, Kate.